This is a recording of this year's Virtual Residency Fair. We'd like to take the time to thank the programs that volunteered their time to present to this year's applicants. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap and Ultrasound Guidance. PM&R Recap is the leading resource for your physiatry board preparation, clinical preparation, audition rotations, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and oral board cases to help you become the best physiatrist that you can be. Head to pmnrrecap.com to learn more. Ultrasound Guidance is the innovative new online ultrasound learning platform that gives you instant access to expert instruction. With rapid scans and complete scans of every joint and peripheral nerve, Ultrasound Guidance is the perfect way to jumpstart your MSK ultrasound learning. Visit ultrasoundguidance.com to learn more.
So, good evening again. So just to introduce myself, I am a PGY4 stationed out of Hollywood, Florida, and I'm representing Memorial Healthcare System. So a little bit of background. I went to Ross University for medical school. Did 2 years there in the islands and did my core rotations as a third-year medical student in Cleveland Clinic, Florida. And then as a fourth year, essentially, I wanted to go to different states other than Florida just to see what they have to offer. So I went to Michigan, Chicago, California, Texas, and then back to South Florida. And I am actually going into pain management. So I find out where I'm at September 25. Very, very exciting times. As far as our program, we want to welcome you. Now, the two pictures you see here, the one on the left, this is Memorial Hospital West. On the right, we have Memorial Regional Hospital South. So this program is a categorical program. So we're talking 4 years total in one, essentially, state or location. All right, they're essentially 10 to 15 minutes apart. So on the left, this is where you're going to be doing your intern year at Memorial Hospital West. And we can talk a little bit more about that in the subsequent slides. Now, the picture on the right, Memorial Regional Hospital South, you're going to spend about 90% of your PGY 2, 3, and 4 year in this facility. All right. This has about 89 beds, and essentially is from the 4th, 5th to the 6th floor. And we've actually been ranked as the top 50 best hospitals from US and World Report, as well as 2023 and 2024. We're also CARF accredited, and essentially what that means is we've been highly audited and reviewed, and it shows that our program or our healthcare system can provide quality service to our patients. So these are the heavy hitters here. So starting from the left to the right, we have Dr. Jeremy Jacobs. Now he is the program director as well as the vice chief. Second, we have Dr. Joanne Delgado Lebron, and she is the associate program director. Next, we have Dr. Jackson Cohen, who's the chief, as well as the medical director. And we have Anthony, the one that holds everybody together, essentially. He's our program administrator / coordinator. Now, these are a couple pictures of our current residents and a couple that just graduated here. So on the left, this is Dr. Jacobs' house. Every year, we have a pool party over there. On the right, we went to Top Golf, and there's a few of the residents that just graduated, but there's more pictures on the subsequent slides in regards to the current residents. So as a PGY1, again, you're going to be at Memorial Hospital West. Now the highlights, it's 24/7 hospitalist and intensivist coverage. You have a ton of exposure to didactics as well as workshops, great patient diversity and pathology, and you're working with the brightest minds in South Florida, essentially. So the PM&R residents work alongside internal medicine, neurology, psychiatry, general surgery, anesthesia, emergency medicine, and OB/GYN. So short and long call, that's predominant as an intern year. So typically short call, you'll leave at 4:30 in the afternoon. Long call, you leave at 6:30 in the afternoon, and you do your sign outs and head home. As far as our rotations, you have 3 months of either full internal medicine floors, or you have 2 months of internal medicine floors plus 1 month of admission service. So essentially, when I was an intern, it was just in internal medicine floors. But it actually split into two. So internal medicine floors, you don't really have new admissions. You may get one in the morning if the night team is capped, but very rarely would that happen. And you're capped at 10 patients for each resident. For the admission service, you're capped at 5 patients for each resident. And this is 1 month blocks. So for ICU, infectious disease, emergency medicine, neurology, and nights, you have a 1 month block of each of those. And then we have a ton of opportunity or exposure to electives. So whatever you prefer, cardiology, endocrinology, gastroenterology, hematology/oncology, nephrology, pulmonology, rheumatology, sports medicine, integrated medicine, allergy, and immunology. So the picture with the residents here, this is the current interns, good group of people. And on the right, this is Memorial Hospital West. And in the bottom picture, this is the Cancer Institute that was recently built and started seeing patients about a year ago. So this is definitely new. And you will have the opportunity to rotate there during your hematology oncology rotation. So as a PGY 2, 3, and 4, again, 90% of your time is going to be at Memorial Hospital South. We see a lot of brain injuries, a lot of strokes, a lot of spinal cord injuries, orthopedics, amputations, medically complex patients, and pediatric rehab. So just a disclaimer, the medically complex rotation has been split. We initially had an attending that started working at somewhere in Jacksonville, and he was in charge of the medically complex service. So what we did was we essentially split the list and provided a lot of the medically complex patients to a few of the services here. So you'll probably have 2 patients who are kidney transplants on the stroke service. On the brain injury service, it's mainly all TBI patients, right? The spinal cord injury service, you may have 1 or 2 of heart transplants. And orthopedic amputees, you may have some liver transplants, a couple, 1 or 2. So the consults you'll see at Memorial Regional Hospital or Memorial Regional West. So again, the top picture, top left, this is Memorial Regional Hospital South. The bottom one, second row, the first on the left, this is Memorial Regional Hospital, where you'll see your consults. On the right-hand side, second row, you have Joe DiMaggio, pediatric rehabilitation over there. And we're going to talk a little bit more about that in the subsequent slide. The third row on the left, we have a community simulation center where we help patients, transfer in and out of vehicles. They have essentially what you call a grocery store, and essentially it's for these patients to, improve their activities of daily living. The bottom right is one of our procedure rooms. So we have essentially 2 procedure rooms, and we also have a new fluoroscopy suite in our clinic. So as far as the outpatient rotations, we have MSK, interventional pain, spasticity and movement disorder clinic, prosthetic orthotic clinic, as well as working alongside with Hanger in Hollywood, Florida. Then obviously we have the TBI, SCI clinic. And then we have a ton of exposure to electrodiagnostic studies. Now at Memorial Regional Hospital, you'll have your sports medicine rotation, as well as your neurology rotation. And at Memorial Regional, you'll also be doing electrodiagnostic studies, working with neurology. Memorial Hospital West, as a PGY 2, 3, and 4, more specifically as a PGY 3, you'll have the opportunity to rotate with Dr. Mehta in integrated medicine. So as a PGY3, you have the opportunity to rotate in pediatrics. So Joe DiMaggio spent a ton of money, $170 million expansion, adding 156,000 square feet of space in this facility. So they added a heart institute, medical surgical unit, intensive care, rehab unit, as well as 72 private rooms. Now we're focused mainly on the rehab unit. So there's 7 beds in that rehab unit. And we have an inpatient rehabilitation gym, several treatment rooms, 6 large inpatient rooms, and a sensory room, virtual reality treadmill, and the BioNest vector track, as well as a new outdoor terrace. So during your pediatric rotation, you're exposed to a ton of botulinum toxin procedures, a lot of pump refills, exposure to wheelchair clinic, NICU clinic, chronic pain, Ehlers-Danlos patients, cerebral palsy, muscular dystrophy, as well as TBI patients. And we also have a concussion clinic as well. So more of the staff here. So first row from left to right, we have Dr. Jeremy Jacobs. Now he's, again, the program director, but he also is in charge of the orthopedics / amputee and multiple trauma rotation. To the right, Dr. Delgado. She's double board certified in PM&R as well as spinal cord injury. Moving on, we have Dr. Jackson Cohen. So he's the chief as well as a medical director, and he is double board certified in PM&R as well as interventional pain. And then we have Dr. Sarah Pastoriza to the right of that, and she's double board certified as well, PM&R, interventional pain, and she also did a second fellowship in regenerative medicine. To the right, we have Dr. Valdez, awesome gentleman here, MSK specialist. You get a ton of exposure to peripheral ultrasound guided injections with him. And to the right, we have Dr. Cruz, and you would work closely with him during your pediatric rotation. Second row to the left, we have Dr. Kletch, and I'm actually working with him now in my electrodiagnostic rotation. Then we have Dr. Janice Cohen, who's in charge of the spasticity and movement disorder clinic, and you get a ton of exposure to the botulinum toxin procedures and pump refills with her. Then we have Dr. Miller here, and he's in charge of the traumatic brain injury service. Moving on, we got Dr. Holland, and she's in charge of the stroke service on the inpatient side, and she also does electrodiagnostic studies in the clinic. Then we have Dr. Torres here, and he sees a lot of, essentially a hodgepodge of cases, a lot of medically complex as well. And we also have Dr. Hart, and you'll be working with him during your pediatric rotation. So a few of our locations, I just wanted to show this image just to give you guys some perspective into essentially how close these facilities are to one another. So for Memorial Hospital West, I don't know if you can see my arrows, but it's in Pembroke Pines. And essentially it's 10 to 15 minutes away from Memorial Regional Hospital South, as well as Memorial Regional Hospital. All right. Now we also have a couple other facilities, one in Coral Springs, and that's when you're doing your pediatric rotation, mainly focusing on concussion management. And we also have, actually another one in Coral Springs, which is your sports medicine rotation. And you'll be working very closely with Dr. Frank during that rotation, and you'll get a ton of exposure to landmark guided procedures as well as ultrasound guided peripheral joint injections. Then you also have a clinic in Wellington, but we rarely go there. So again, we're everywhere, essentially. And this is Dr. Joanne Delgado Lebron having her image in the Fort Lauderdale airport. So she was actually very surprised to see that image. So as far as our extracurricular activities and experiences, there's a ton ton of things that you can do outside of the inpatient or in the clinics as far as Memorial goes. We have a lot of adaptive sports expos. Fort Lauderdale Sharks basketball team. You can visit the games there. They actually were #1 last year. We also have an annual adaptive bowl-a-thon, and that's actually coming up in September 22nd at the Spares Bowling Alley. So if anybody's currently in South Florida, consider visiting. We're happy to have you join the team. And lastly, we have Adaptive Sports and Recreation Expo Water Ski Extravaganza. All right, say that 5 times fast. As far as our scholarly activity, we spit out a ton of case reports, a bunch of research publications. And last year, we had 22 posters presented at conferences from AAP, AAPM&R, FSIP/FSPM&R, Aspen, as well as NANS. The picture on the top left, this is actually one of the journal clubs that we get to attend from Cantor Spine, and a few of our residents here, and one of the seniors that graduated and is now working in private practice within interventional pain, Dr. Volker. And on the right, we have a couple of our PGY3s, and I believe this is an AAP conference. And then the last row to the left, this is in New Orleans, AAPM&R conference is also on the bottom right. So for our program, it's mandatory to do 1 QI project during the residency, but it's very simple to do this quality improvement project. And if you need any assistance, we're happy to help. We also have a Memorial Sports Medicine Journal Club and lecture series. Then we also have this MHS Office of Human Research Annual Research Week poster competition. And essentially, it's a lot of staff stationed in Memorial Hospital West, and we compete to see who has the best or the most interesting case. We also have the Pain Journal Club, which I spoke to earlier. As far as our salary, from PGY1 to PGY4, PGY1, you started at $59,654. Now, disclaimer, this is from last year, so it may increase. PGY2, you get $62K, a little bit more than that. PGY3, you get $64. And then as a PGY4, you get $67,038. So for paid leave, you have 25 days, including vacations, sick, and holidays. Wellness days, there's 4 half days or 2 full days. It doesn't matter if you want to do 4 or you want to do 2 full days or 4 half days. It depends on, what your preference is. And we have a $1,000 stipend for Q banks or books. And I posted a couple pictures here on the bottom, essentially a list of all the books that I've purchased with that stipend. So every year you're getting $1,000 to buy books or question banks. You also get $1,750, which was increased from $1,500 last academic year for conferences. So with that additional income, you can definitely attend an additional conference during your academic year. And we have free food all day, as well as free parking. Benefits, health, dental, life, disability insurance, really good, strong work-life balance, as well as subsidized childcare, which is important to me since I have 2 young boys, a 4-year-old and a 3-year-old. We also have integrative medicine visits. The initial visit is free, as well as free psychology and life coach consultations, and free acupuncture every year. So I wanted to add a couple of these slides because majority of the information is going to be kind of redundant for all the programs throughout. So I wanted to see, it's the little things that add up, right? What's going to separate us from all the other programs? So I think this is pretty important. As far as our Memorial Healthcare System, PM&R residency program, we have a robust interventional pain medicine exposure. So we have three interventional pain physicians, and essentially, as a PGY2, you start getting hands-on exposure to minimally invasive procedures in the fluoroscopy suite or in the operating room, right? So before last week, we actually had two interventional pain physicians, but one was started today, actually started seeing patients. So by the time you guys start during residency, it's going to be up and running, and you're going to have three full-time interventional pain physicians. So for as an example, just to give you guys some context, 3 days out of the week, we're in the clinic and we're seeing roughly 15 to 20 patients a day with either Dr. Jackson Cohen or Dr. Sarah Pastoriza. 2 days out of the week, we're in the operating room. And we have a ton of exposure to these minimally invasive procedures, including facet injections, medial branch blocks, epidurals, whether it's interlam or transforaminal, even more if you're advanced, including lumbar sympathetic blocks, ciliate ganglion blocks, spinal cord stimulator trials, as well as implantations with those two pain physicians, and Dr. Reed as well. So three, as well as backlift and pump trials, as well as implantation, and a lot more.
Dr. Guzman, I'm sorry to interrupt you. You're actually over time. I will give you 1 extra minute if you want to answer any questions. Thank you.
Sure, I'll just finish with this because this is pretty important. We have a robust MSK exposure, tons of ultrasound landmark guided procedures, as well as an ultrasound gains course, sports coverage. We have rugby, football. We also do physicals for FNU, FMU, as well as University of Fort Lauderdale. We have excellent spasticity management, including botulinum toxin injections, as well as pump refills. And then we have a ton of exposure to TBI, SCI, a lot of amputations, prosthetic and orthotic exposure, and great EMG nerve conduction study exposure to complex cases. And there's more. There's always an event going on at Memorial or invitations to dinners by reps. We have that increase in the conference stipend to $1,750. We have a huge resident lounge. Each class has its own workstation. No short or long call days as a PGY 2, 3, or 4. We have home call. Everybody's friendly. We have free food with grills open most of the weekdays. Free parking. Intramural sports, including kickball, soccer, basketball. And there's a lot of camaraderie amongst these residents and attendings. And you get to network with the brightest minds in South Florida. And here are the few of the images representing our program and some of the events that was held in intramural sports, essentially a picture of our resident lounge. And in South Florida, there's a ton of things to do, a lot of good teams as well. You can go spear fishing, you can wrestle alligators if you like, go fishing, watch the Florida Panthers. We actually won the Stanley Cup last season. Excited about that. We have Miami Marlins, Miami Heat, the Dolphins, you name it, we got it. As well as tons of places to visit. We got South Beach, Palm Beach, Fort Lauderdale, Las Olas, Wynwood, Disney World. And here's a few of the images of our residents. Thank you, guys.